I'm Karen Deininger. I'm the Director of Nursing Facility Manager for Barcaldine Hospital and the Eastern Hub and the Central West Health Service. So I made a tree change approximately 15 years ago. I spent 20 years working at the Princess Alexandra in Brisbane. You know, one of the things that really triggered me to come out here was I was so sick of the traffic in Brisbane. It was one day I was driving home from the PA and it took me over an hour. And I just went, you know what, there's more to life than this. So I packed up my husband and my son back in 2009 and moved to a little place, Muttaburra, which is part of the Central West. So I worked in a remote clinic for 7 years on and off between Muttaburra, Boulia, Aramac, and just dived into that remote nursing. And I know we do kilometres here now, but on a day-to-day basis, I ride my push bike to work. It takes me 4 minutes. I ride up the ramp, I park it on the verandah. I have no parking fees, I have no traffic to worry about. It's just been a great move for the family and professionally for myself. So we certainly work to our full scope of practice. Especially in the remote clinics, you are the ambulance-based service, so you're doing pre-hospital trauma, life-saving courses. I've done my advanced life support, my paediatric life support, and we do get to use those skills. So we have a lot of specialist support services that cover Central West, and we have a palliative care team in the Central West, and we're fortunate that they actually live here in Barcaldine, so they're on site and are a great resource for us to provide palliative care for our local people in the hospital. So as much as we can provide here means that people don't have to go away. The medical staff listen to the nursing staff, we listen to the allied health. It's a one team approach for our care on a day-to-day basis. We're a supportive team and it's a nice place to work. In all my years of nursing and being a manager, one of the key things I find, and that doesn't matter where you are, is people who come to work with a smile on their face. I also think that people need to be able to think outside the box. So often, you know, we have position descriptions, all these things that we're supposed to do. But then something left field comes out and you go, is there someone in front of me? No. Is there anyone behind me? No. So, it must be my job. And I love that, being able to adapt, be resourceful and think outside the box, which I think is what rural and remote nursing is. It's really important to have that personality trait. It's different nursing, it's very different nursing, but I think it's just being in part of the community. So you live and breathe in the town, you work in the town, so you get to know community people, and I think that's just such a bonus. You know, there's a huge amount of trust put into the hospital and the community respect you for that, but they also know that you live in the community, so you can let your hair down sometimes and have some fun, and then I can go back to the hospital and I'll be my professional self that I have to be. I've looked after children who, when they were babies, and now they're nearly finished school, and so you get to see the children and the families growing up, so you become part of the community. I love it, that's it. I've been here for 7 years and I'm not moving.